I'm Dr. Winnie King in the lobby of the Children's Hospital at Montefiore in New York City. Do you know what cystic fibrosis is, or we also call it CF? Well, it's a life-shortening disease that clogs a child's lungs with thick mucus. Now, to loosen the congestion, CF patients use vibrating vests, they breathe in mist through a mask, and they have family members pound on their backs. And over time, the congestion and the therapy become serious obstacles to a normal day-to-day life. But there are young CF patients out there who stay positive despite all of the challenges, and Kim Benet is one of them. We gave Kim and her family a home video camera to share a bit of their lives with us. Here's Kim's story through their eyes.
Good morning. I just got up. It's a little past 6:30. Normally I don't wake at this hour at all. I just wasn't able to breathe so well last night, so I'm going to do my machine a little bit early, and hopefully that will help me breathe a little bit better. I just put the little medicine in here. I'm supposed to do this every 4 hours, and I put it on, and usually lasts about 20 minutes, and hopefully it will prevent me from coughing. So that is it. Here I am, doing my machine.
This precursor helps loosen up the mucus in our lungs. How many times do you have to do this a day?
I'm supposed to do it at least 3 times a day. Andy's going to show us how we do a game to help me do the bronchial drainage. He's supposed to hit me on the back, but that's boring.
So I do a song, and she has to try to guess the song.
Go ahead. That's all. You stumped me. What is it?
Happy birthday.
Fraudulent! I'm just getting ready to go into therapy. I do it 2 times a week. He takes our blood pressure at the beginning and the end. So just monitor us. Now, before we work out every day, we do squats. We have to do as many squats as possible. We're just supposed to do it, and it helps build our endurance. So I'm supposed to do additional 5 each week, but I'm stuck at 55 and I can't seem to get past it. 5 and 6. So I beat my goal. Okay. Okay, so we just got back from therapy, so as you can tell, I'm a little bit drained. I always like to fall asleep, and, well, I don't like to, but I do. After I come home, I take a nap. Okay, so I'm just getting ready to take my nap in my comfy bed, and I thought while we had some time alone, I'd give you some insight onto what it's like to live daily life with cystic fibrosis. There's obviously a lot of downsides because I do have to do a lot of machines during the day and medications, but it's great. I mean, I'm very fortunate. I have fabulous doctors, a great family who's very supportive, my extended family, not just my immediate family, and fabulous friends who will ground me and bring me right back down to reality whenever I'm feeling even a little bit sorry for myself. Sometimes I feel like that commercial. Instead of time to make the donuts, it's time to do a treatment.
Sometimes she sprays me with the medicines.
You're not supposed to tell people that. You'll get me in trouble. This is my mask that I do when I'm tired, so then that way I can just fall asleep when I do it.
This is your vest. Plug me in.
Start off low. This one makes me talk funny. I'll keep the vest on for about 20 minutes to a half hour. Everything is pretty much okay. I can deal with everything about the disease. The one thing that I cannot deal with is needles. Doesn't matter how old I get or how many times I've been stuck, I'm a big chicken. I hate them. I weep. I cry. The nurses have to come in, even though there's a 6-year-old in the waiting room. They have to come into the 26-year-old who's freaking out in the room because she's about to get stuck. I'm getting ready to go to bed now, but I really don't want to do my oxygen tonight. I'm going to be a bit stubborn, which I do from time to time, but sometimes I just don't feel like doing all the medicines and all that. And I want to listen to my CDs tonight and maybe put some candles on. So I'm not going to use my oxygen, but it's okay for just one night. But I'm very excited to have a nice, delicious night's sleep.
Yay!
Boy, what an amazing story. Kim, with all of the treatments, the therapy, it sounds like this is a full-time job.
Yeah, it definitely is. It's getting to be a bit more as I get older. It didn't really affect me that much when I was younger, other than at recess, I used to have to stay in. But I personally think that was a good thing because everyone else was out in the cold. I was nice and warm in my place. Yeah. But I think there's just so many more benefits and disadvantages. Like, for instance, when I was younger, I used to get to go out and give some of the Yankees awards on the fields.
Really? So you got to meet celebrities?
Yes.
Wow. Now, but does it ever become overwhelming?
Yeah, it definitely does. I mean, I'd, be not telling the truth if I said otherwise, but it does become overwhelming. But, like I said before, it's just like I just have an amazing support system, and it helps me. Yeah. And it also, I think, makes me a little bit more competitive because if it becomes overwhelming, then I'm a bit stubborn, so I get annoyed, and I want to overcome, whatever it is.
Well, speaking of support systems, Kim's mom, Chris, is here with us today, and Kim's doctor is Dr. Joan Germana, and she's the director of the Cystic Fibrosis Center at Snyder Children's Hospital. Welcome, both of you, to the show. Boy, this is such an amazing story. We're so glad that we're here talking about cystic fibrosis. But, Joan, let's start from the very beginning and talk about what exactly is cystic fibrosis and what does it do to your body?
Well, cystic fibrosis is an inherited disease. Parents are carriers of the disease. It affects the salt and water movement across cell membranes. And predominantly the lungs and the gastrointestinal system are involved. So with the lungs, you get recurrent infections, thick mucus that's difficult to expectorate.
Which is to cough up, to get
cough
out.
up, right. You can see some of the treatments Kim was doing on the film. And then also with the gastrointestinal system, you have symptoms of difficulty gaining weight. You might have frequent bouts of diarrhea. And those are the predominant symptoms. It's a disease that shortens the life expectancy of individuals.
And the good news, though, is that back when I was a medical student a million years ago, the life expectancy was quite different than it is today. How have we come with that life expectancy over the years?
Well, back when I was born in the early 60s, patients lived to just actually preschool age. And now patients are living to like 32.4 years. So we've really come, quite a long way in a short period of time.
Now, Chris told us that Kim wasn't actually diagnosed until she was about between 4 and 5 years old. Is it very obvious to pediatricians and other family care doctors when a child has cystic fibrosis, or are there some things that parents really need to be looking out for?
Well, actually, in the country, 4 is about the average age, and there are things that a pediatrician can look for, but the symptoms actually could be quite subtle. So parents should look for things like bouts of diarrhea that are frequent, occur every month, or occur if the child has a particularly fatty meal, like, say, fast food.
Yeah, any kind of fast food, not one company in particular, but just fast food where there's a lot of oil, a lot of grease in the food.
Right. Also, a person gets a cold. The average person gets 6 colds a year. A patient with CF might get a cold, but it would be a very prolonged cold. They would need antibiotics to get well. So parents can look for difficulties growing, gaining weight, not on the growth curve, or frequent respiratory infections. Those are all things parents could look for.
And besides what we saw on the tape just a few moments ago, what are the other kinds of treatments that are available now for CF?
Patients are frequently on oral or inhaled, in particular inhaled antibiotics, that's by the nebulizer, or patients, if those aren't working and they're still having problems with their breathing, they'll have IV antibiotics, which, obviously Kim is familiar with. Also, it's important for patients to exercise, to use the lungs. That's the purpose of the lungs.
And actually, at one point, though, because you were told to not allow your daughter to be very active, but you didn't do that. You allowed Kim to be pretty active when she was a young girl.
Yes, well, when she was diagnosed, it was over 25 years ago, so that's when they were telling us to, this is a sick child and you should keep the child down.
But not with Miss Kimmy. You did a lot of things. Tell us about your lifestyle and what you've been doing.
Oh, I was just always very active. I mean, I love to be doing stuff. I swam when I was little, then I cheerleaded, and my favorite thing was horseback riding, which I'm actually in the process of trying to get healthy to get back to.
And we see you doing that right now. Boy, you look wonderful on that horse. That's a real pleasure for you, and that's also a great form of exercise for you. How does that affect your CF?
The exercise?
Yes, the horseback
riding.
Oh, the
horseback riding? Well, it was good because it bronchial drainage, just like when my brother, you saw pounding on my back. It kind of bumps me around and just gets my lungs moving, and you use so many muscles that you wouldn't even think you had to use, so keeps you in shape.
So you're having fun, and it's also helping you. And now when you were in college, you were actually a double major?
Yes.
Wow, how did you do that and manage your CF at the same time?
I was pretty fortunate because I really didn't get sick until sophomore year in college. I think a combination of that and a little too much partying, but...
Oh, yes, well, and you're brave to say that next to your mom sitting right here on the set. That's pretty good. Well, but a couple of years ago, your health really started to change. Tell us about that. What happened?
Well, I was working for a fabulous company named Lehman Brothers in New York City, and I got a flu. I hadn't gotten my flu vaccine that year, and I got a flu, and it just progressed into pneumonia, and I lost a lot of weight, and then, you know, it just kind of spiraled, and I haven't really gotten back up to that point again because I was in and out of the hospital, I was on IVs, and it just kind of, you know, my health has deteriorated, and now I'm on disability, unfortunately.
It must have been a pretty big shock. I mean, you've gotten through college, you had a job, you're doing well, and then all of a sudden, everything changes. You know, the devastating part of CF is that at a certain point, the doctors just run out of ways to fight back, which is an overwhelming reality for the family to face. Kim and her mom each took some time alone with our home video camera and revealed how heavy that emotional toll really is.
It's very hard when Kimmy gets sick to not blame anyone or any being for why she has to suffer like she does. But she does.
I got real sick in college. Problem is I got a flu. And the bad thing about getting a flu with a person with CF is it just further complicates everything. You get a flu, then that leads to more increased lung infections. Then when you have more lung infections, you get sicker, you lose weight, and it's just like a spiraling cycle. It just keeps getting worse and worse. So, I mean, we all knew eventually it would happen. I'd be hospitalized, but, you know, you're just never prepared for it.
You're watching your child suffer in such a terrible way, trying to grasp for air and not being able to breathe. I think that's the hardest. It never stops hurting. Just never stops hurting.
I got another sort of flu, and it just progressed, and I couldn't get better. I was in and out of the hospital for about 2 months, and I found out that I needed a lung transplant. Oh, sorry. I found out. That I need a lung transplant.
And we just always keep praying that God will be good to us and let us have Kimmy as long as we can.
Well, obviously, Kim and Chris, you guys are facing a really, really tough situation, and we certainly empathize with you on that. Joan, I know there have been a lot of advances, in particular the lung transplant surgery. That's really been a huge innovation when treating cystic fibrosis. You know, is this really about the only thing that we have available right now for severe advanced cases of cystic fibrosis?
Actually, yes. Right now, when physicians, we basically run out of options, transplant, double lung transplant is the only option. The transplant, however, you're really replacing one disease with another disease. The new lungs will never get cystic fibrosis. That's the good news. And the quality of life the person has after is wonderful. It returns them back to being active again. But the new kinds of complications, new medications are often very difficult to cope with because it's different from what people are used to.
So you wouldn't describe this as a cure for cystic fibrosis?
No. We wouldn't really use that word. Yeah. I mean, you'll never get CF in your lungs again, but you're going to get it
in other parts of the body.
Yes.
And at what point in a person's disease do you recommend that they consider a lung transplant?
Usually we monitor lung function by lung function tests, and if the lung function numbers fall below 30%, and the person's having increasing lung infections, and we're having difficulty, getting them better, we will consider it.
Kim, have you been thinking about a lung transplant?
I've definitely been thinking about it. I've been doing a lot of research, talking with a lot of people. One you'll meet in a little while. But at this moment, I'm more on the side of I do not want it.
I know that you're afraid of those needles. Is that the reason why? Or what's going on? Why are you against
That is
it
a lot
at
of
this
it because I've had problems with high blood sugars before and got kind of a subdiabetes, and I give a lot of credit to people with diabetes because I could think that there's no worse thing for me. Between the monitoring, I love to eat. I'm a big fat pig.
No. Let me just give you a huge newsflash. You are not a big fat pig. But one of the side effects, if you will, of having this transplant is being on steroids,
Yes,
things like that,
exactly.
that could cause you to develop diabetes, and
Yes.
you're concerned about having to give
The
yourself
needles
insulin
and then
shots.
monitoring my food and
Yeah. So this really isn't for everyone. There are some things to consider that are maybe not so wonderful with the lung transplant.
Absolutely. I think it's a very individual decision. There's a very long wait time, 2 years, and it's very difficult to wait for a transplant. It's very traumatic, very stressful, and then you're exchanging one disease for another disease. And